Hi guys, Jane here. Today's topic is about botulinum toxin A, and thank you for the great question about how it works. So the question's about how does botulinum toxin A work. Before we progress with that, we need to really understand that this is a prescription only medicine. So it can only be prescribed by someone who is a registered practitioner, that's a nurse or a doctor that's also an independent prescriber. And before we even progress to a client receiving botulinum toxin A, you need a full consultation, which will include your full medical history. And if that is all okay, then we start to discuss, is botulinum toxin the right treatment for your aesthetic concerns, which are normally lines in this glabella region, or lenses that clients call them, lines at the top of the forehead there in this frontalis region, and smile lines here, just along the oculi, and bunny lines. So when clients crinkle up the nose, they get little lines there. So I'm going to show you a little bit more detail about how that group of muscles sits within your face and how the toxin works. So we would inject centrally here, hitting the glabella region. We'd go across the frontalis to get those horizontal lines, laterally to get the oculi or the little crow's feet, and the bunny lines. And also we can also treat this area when clients complain of a downward turning mouth or a sad mouth, and that doesn't reflect how we're feeling. So botulinum toxin, how it works is it produces an acetylcholine, and in summary, that is, if you remember from your biology days, the neuroceptors, these finger-like projections that make muscles work, it just stops the messaging. So when you want to be frown or get cross, the messages just, they don't transmit. So that's why your muscles don't move. And obviously when you don't use a muscle, it becomes less bulky, and that's when these fine lines fade and disappear. And we've discussed previously that we would expect a toxin to last about 3 to 4 months. And in my experience, the lines or the smile lines that we've treated, they never come back to the place where we started originally.